So a tummy tuck is an operation to remove excess skin and fat from the lower tummy, and the medical term is an abdominoplasty. There are three main categories of tummy tuck. There's the mini tummy tuck, which doesn't involve moving the belly button. There's the standard abdominoplasty or tummy tuck, which involves moving the belly button. And there is an extended or fleur-de-lis abdominoplasty, which involves a more extensive scar for patients who have been very, very heavy previously. The operation almost always is performed in women who've had a previous pregnancy, and therefore stretching of the lower abdominal skin and fat, and often with associated stretch marks as well. The operation involves a transverse scar, that is a horizontal scar, typically just above the pubic hair, and ideally to match the size and style of the patient's underwear so that it's hidden when they're wearing briefs or bikini. The operation is almost always done under general anaesthesia, although a mini tummy tuck can be performed under a local anaesthesia if the patient is so willing. Very often, liposuction to the flank areas is performed in addition to the tummy tuck to further improve the contour of the tummy. The operation takes anything between 1.5 to 3 hours and involves a hospital stay typically of 1 to 2 nights. If considering a tummy tuck and preparing for the operation, one needs to do a lot of research beforehand to find out as much as possible about the operation, what's involved, who your surgeon is going to be, their background and their training. During the consultation, you'll want to ask all sorts of questions such as the recovery. For example, if you have small children at home, you'll need help, at least in the first couple of weeks, because you'll not be able to lift them. Other things you need to consider are any garments you need to wear. Now, after an operation such as a tummy tuck, you'll need to wear a compression garment which will give support to the operated on area and give some shaping if you've had some additional liposuction, particularly to the flank or back areas. The operation typically is performed under general anaesthetic, and you need to be medically fit. If you're a smoker, you must stop smoking before tummy tuck, in my opinion, otherwise there is a higher risk of complications. It's important that you avoid any medications that may thin the blood and therefore increase the risk of bleeding. Such drugs include aspirin, ibuprofen, Nurofen, or Voltarol, diclofenac. There are three main kinds of tummy tuck. The mini tummy tuck, which is performed with a shorter scar just above the pubic area, similar to the caesarean section scar. A standard tummy tuck, which is a scar from hip to hip and involves incision around the belly button, and the fleur-de-lis abdominoplasty, which involves a bigger scar which runs from hip to hip, but also vertically down from the belly button down to the pubic area. And that category of operation is for patients who've lost a lot of weight. It's performed tummy tuck under general anaesthesia and lasts typically 1.5 to 3 hours. And many surgeons will perform liposuction at the same time to further improve the contour of the tummy. The tummy tuck surgery is carried out by performing an incision and lifting the skin and fats away from the underlying muscle and freeing everything up and allowing the skin and fats to be pulled, tightened and recontoured. Now, after pregnancy, very often the abdominal muscles, the six-pack muscles, become widened, become separated, so-called rectus divarication. And in those cases, that needs to be retightened again back into the midline to give a further improvement in the contour and also to support the tummy as well. I've seen many patients who've had quite a wide gap between the muscles and the tummy wall, such that you could almost get a sort of a hand's width between the muscles, and those patients often suffer with back pain, and which may be improved after surgery. Immediately following a tummy tuck, your tummy will feel tight, and very often you'll be nursed with some pillows under your knees to help to keep your hips flexed and to keep the tension off the tummy. After a couple of days, the patients will tend to be able to walk upright, but will be wearing a garment to give support to the tummy and the flank areas. Patients typically will have about 2 weeks off work because they'll be unable to drive or to lift heavy weights, and be back to normal activities at about 4 to 6 weeks after a tummy tuck. Certainly, patients should be thinking about flying after that sort of operation, and that's why having surgery abroad is certainly not necessarily in best interests. The risks of a tummy tuck operation can be divided into those due to early things and late things. Now, early things include bleeding, which can occur due to certain medications, such as aspirin, warfarin, Nurofen, and certain supplements. So you should discuss these with your surgeon beforehand. Poor wound healing is one of the risks, particularly with smokers, and again, this is something you need to avoid before an operation. Infection is not very common after a tummy tuck operation, and most surgeons use antibiotics as a precaution in any case. There is some numbness in the area of skin above the scar, which typically is temporary, at least in a large part, it's temporary. If you've had liposuction as well, there may be some swelling, which may take a few weeks or even perhaps a little bit longer to fully resolve for you to see the final result. And the quality of the scar is also something you need to discuss, because if you've had poor scarring previously, then precautions need to be taken to minimise the chances of it happening again.